welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Want to preserve brain health? Address sleep problems. AAN study. People in early middle age who have poor sleep quality, including having difficulty falling or staying asleep, have more signs of poor brain health in late middle age, according to a study published online in Neurology, the Medical Journal of the American Academy of Neurology. The study does not prove that poor sleep accelerates brain aging. It only shows an association between poor sleep quality and signs of brain aging. The study included 589 people with an average age of 40 at the start of the study. Participants completed sleep questionnaires both at the beginning of the study and again 5 years later. Participants had brain scans 15 years after the study began. Researchers reviewed participants' response to questions such as, do you usually have trouble falling asleep? Do you usually wake up several times at night? And do you usually wake up far too early? They recorded the number of 6 poor sleep characteristics for each participant: short sleep duration, bad sleep quality, difficulty falling asleep, difficulty staying asleep, early morning awakenings, and daytime sleepiness. Urine test may reveal early signs of genitourinary diseases, study finds. According to a new study from scientists at the University of Texas at Arlington, Chan Zuckerberg Biohub and Stanford University, studying the RNA and other substances within urine can show changes in cell types, revealing early signs of cancer and other diseases. This method could help clinicians detect problems earlier when they are more easily treated without invasive procedures. The current gold standard for detecting many genitourinary ailment is a biopsy, where small tissue is removed during a rectal exam and sent to the lab for analysis. The invasive nature of the test can scare some people from getting the care they need, said Joseph Buonomo, assistant professor of chemistry at UTA and author of the study. Our preliminary research shows that studying the RNA found in urine can detect some ailments in their earlier stages where they are easily and cost-effectively managed. Why our brains are effective at quickly processing short messages. A new study by a team of New York University linguistics and psychology researchers has discovered that when a brief sentence is flashed, our brains detect its basic linguistic structure extremely quickly in roughly 150 milliseconds, or about the speed of a blink of an eye. Our experiments reveal that the brain's language comprehension system may be able to perceive language similarly to visual scenes, whose essence can be grasped quickly from a single glance, says Lena Pilkanen, a professor in NYU's Department of Linguistics and Department of Psychology, who led the research, which is reported across papers appearing in Science Advances and the Journal of Neuroscience. This means the human's brain processing capacity for language may be much faster than what we might think. In the amount of time it takes to hear one syllable, the brain can actually detect the structure of a short sentence. Can loss of sleep impact brain development in babies? A new study led by Sean Gay, a graduate student in the lab of Graham Deering, PhD, assistant professor in the Department of Cell Biology and Physiology at the UNC School of Medicine, has given us insights into how sleep loss during early life impacts key parts of brain development and how it can also increase one's risk for developing autism spectrum disorder. Their findings were published in the Proceedings of the National Academy of Sciences. The unique effects of sleep loss during development are largely unexplored, said Deering. Our data showed that babies and children are more vulnerable to the negative effects of sleep disruption. We also found that sleep loss during the crucial period of time can negatively interact with underlying genetic risk for autism spectrum disorder. Deering has long studied how sleep strengthens synapses over time, a process termed synaptic plasticity, and how lack of sleep can contribute to cognitive and neurodegenerative disorders. If researchers could better understand the links between sleep and ASD, researchers and physicians also could make earlier diagnosis and come up with new treatment strategies for the disorder. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.